Hello friends, I am Dr. Gupta. I am Senior Consultant Orthopedics and Joint Replacement at Ashirwad Orthopedics in Haryana. Today I will be talking about a few points on arthroscopic ACL reconstruction and ACL tears. What is an ACL? ACL is one of the most important ligaments inside the knee. It helps in stabilizing the knee and it helps in providing stability to the knee while walking, running and doing physical activity. I'll show you an ACL on a model. So this is the knee joint, this is the femur bone, this is the tibia bone. If we put aside the patella, this is inside of the knee. These are two meniscus which act as shock absorber inside the knee, and this is the ACL ligament. Another ligament is behind, which is the PCL. These both ligaments act synchronously and provide stability to the knee to prevent knee moving from front to back and from rotating side to side. So how does it get teared? ACL gets torn during sports like football, fall while playing any kind of running sports. It can also get torn during road traffic accident or during normal falls as well. What are the symptoms of ACL tears? In cases of acute ACL tears, the most common symptom will be pain and swelling in the knee. The patient may or may not be able to walk, but the walk will not be stable. The patient may feel that the knee is giving away and instability will be there. The knee may also be red and swollen. In cases of chronic ACL tear in which the ACL has torn long ago, the patient may complain of instability while walking, the patient may not be able to walk fast or run, and the patient may not be able to take sudden turns while walking. So how do we diagnose ACL tear? The most common diagnosis of the ACL tear is done on clinical examination, where the knee usually pivots on examination. It can be confirmed via an MRI scan, in which one can clearly see if the ACL is torn or not. So what are the types of ACL tears? The ACL tear can either be just a sprain in the ACL ligament, which is usually treated with conservative management. It could be a partial or a complete tear. In cases of complete tear, it usually requires surgery because these ligaments won't heal by themselves. But as far as the partial tears go, which are also very common, the more important thing for these tears is whether these ACLs are functioning or not functioning. The partial tears may be able to function, the partial tears may not function. So that is done by clinical examination and history. If a patient comes with a partial ACL tear, but the ACL is functioning well, then we usually don't need surgery. But with a partial ACL tear, if the patient is giving complaints of instability and clinical signs of ACL tear are present, then it usually requires surgery. So how is ACL tear operated? It is done via keyhole surgery, in which small holes are used to put a camera inside the knee and see what is happening inside the knee. When the ACL tear is found on arthroscopy, a small cut is given and some grafts are taken from this inside the body. So, how are the ACL tears operated? These ACL tears are usually reconstructed via arthroscopic surgeries. Arthroscopic surgeries are minimally invasive procedure in which small holes are made on the knee and through which a camera is put inside the knee. You can see the torn ACL via this camera on a big screen. And if it is torn, then it needs to be reconstructed via a graft which is taken from inside the body. These grafts are usually hamstring grafts or patellar tendon grafts. Even quadriceps graft can be taken sometimes, but the hamstring grafts are the most commonly used grafts for ACL reconstruction. This graft is prepared, and using this keyhole surgery, the ACL can be reconstructed. Once the ACL is reconstructed, the patient can be mobilized immediately after surgery. Usually we mobilize them next day when the effect of the spinal anesthesia goes off. The patient can be discharged the very next day. So how long is the rehabilitation for ACL? The rehabilitation depends on the goal of the patient. If the patient is a sports person, then rehabilitation usually takes around 2 to 3 months. For a normal patient, he will be able to resume his activity within next 2 to 3 weeks. The stitches come off after 2 weeks, and the patient will be able to walk normally immediately after surgery. The gait training takes place for around 2 to 3 weeks. As far as the contact sports go, usually we don't allow running for at least 6 months, and the contact sports like football, tackling, rugby, running usually after 6 to 9 months. Many a times patients want to ask how painful is the procedure. So, with the current level of technology that we have, with the current level of imaging and the equipment, the pain is usually very minimal. It is within the bearable range. The patient can be mobilized the very next day. He needs to take some painkillers on and off for around 5-7 days, but it is not something that cannot be managed easily. The patients are very comfortable after the surgery, and they can resume their normal activities like office within 2 weeks to 3 weeks.